I get asked to explain the Richmond agitation sedation scale quite a bit, so let's do a little demonstration featuring my husband. Alert and calm is the easiest. Patients are alert and calm, able to make eye contact, and sometimes have a conversation with you. A RASS of -1 means your patient is drowsy. They are not fully alert, but they can have sustained awakening and eye opening. They'll be able to make eye contact with you and sustain that for greater than 10 seconds. And typically they go right back to sleep. A RASS of -2 is light sedation. Patients can briefly awaken to your voice and make eye contact, but for less than 10 seconds. RASS scale can be used on vented and non-vented patients, but obviously I can't intubate my husband. A RASS of -3 is moderate sedation. These patients may have eye opening or movement to voice, but no eye contact. Typically, it takes repetitive stimulation in order to get them to open their eyes. But even then, they will not directly look at you. Sometimes it can look like they're staring off into nowhere. A RASS of -4 is deep sedation. There's no response to voice, but movement or eye opening to physical stimulation. If your patient's a RASS of -4 and not intubated, then I am concerned about them protecting their airway. You can see he only responds to painful stimulation on his fingernail. A RASS of -5 is unarousable. No response to voice or physical stimulation. These patients are usually a GCS of 3 or paralyzed. And if they're not intubated, I'm concerned about their airway. A RASS of +1 is restless. Your patient may be anxious, but their movements are not aggressively vigorous. They may be picking at things or pulling at things, trying to take their gown off, and they're just a little bit more hyperactive, not super calm. A RASS of +2 is agitated. Your patient has frequent non-purposeful movements. They may be fighting the ventilator or their restraints. They're not always making eye contact with you, and it can be difficult to redirect these patients. A RASS of +3 is very agitated. These patients are pulling or removing their lines. They are aggressive. They may be trying to get up out of bed or escape, and you definitely need to be careful. And a RASS of +4 is combative. Clearly, my husband loved this scene a little too much. These patients are combative, violent, and immediate danger to staff. This is where I would be calling security and stepping out of the room until it's safe to take care of the patient.